Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology. Good morning, Bill. How are you today?
I'm doing great. How are you?
Wonderful, as always. And it's always great talking to you about all the exciting things going on. There's been a lot in the news lately about infectious diseases, of course. We're always
Yep.
having re-emerging pathogens. And it really got me thinking about how the U.S. addresses emerging pathogens and how it's so important to have a partnership between public health labs, but also the private or clinical labs that are often serving as the front line of defense. So
Yeah. Yeah. It's
what are
interesting.
your thoughts on that?
Even as you kind of pose the topic for us today, it takes me back to, I guess both of our time. It's been a very interesting time to be in leadership over the last decade
Yeah.
around some of these issues because, I think of pre-pandemic dealing with Zika virus and kind of some of the challenges there as it was spreading and we needed testing for it and there was concerns around the impact on pregnancy and all of those things and also Ebola virus, a lot of discussions around that and what was the because of though that high likelihood it's can be a very devastating infection. So that was kind of pre-COVID. Then
Hmm.
COVID comes and there's this overwhelming need for access to testing and don't need to recount some of the challenges that the public health labs had almost immediately with that. And so there was this real need for the private sector and the private labs, meaning not public health labs. When you think private, we
Hmm.
think of like corporate, but that includes anything that's not a public health lab. So any
Right.
academic lab or anything, there actually needed to be um, a framework, a legal framework for the public health labs and the other private labs to work together, right? And a lot of that was codified in the Pandemic All Hazards and Preparedness Act, or PAPA, right? That enabled the government to actually be able to reach out because the government actually you know, has to actually have the deemed authority to do that from Congress. And so we were able to do that. Gosh, there was so much that happened there and thinking about how we responded. But then things have kind of returned to the what I would say is the pre-COVID state in that
Hmm.
it's not like we're not still dealing with these things. To your point, there's still mpox, which is out there, and there's still also bird flu, which is out
Hmm.
there now as well, and others. We need to continue to, and Ebola is still there, and Marburg virus. We've seen these other outbreaks that are
Hmm.
of concern. So we need to really think through about what is an effective way for the private sector, the private laboratories, and the public health labs to work together. And we do also have to push for the legislation to be reauthorized because actually that bill has not, it needs to be reauthorized, Papa, and it has not yet. But anyways, there's to your point, we learned a lot with COVID. We gained new capabilities with COVID. The question is, how do we make sure that those persist? We talk a lot about virtual care, but there's also this for testing, which is really important for the country. And then what's the best way to do it and what's the why behind it? And I think that you of course, are a world expert, some of the why and the how, but there's a couple of real world examples we're still dealing with right now.
Oh, absolutely. Boy, Bill, you're really bringing me back too when you're talking about, the Ebola. I actually remember shortly after I started in 2008, then 2009, H1N1 came. And I remember being the laboratory director of the virology lab on the phone every day with the public health lab, listening to how they were testing patients. And of course, they had limited resources. And we felt so powerless because we wanted to help. We wanted to be able to test, and there were no tests available. And we've come a long way since then with COVID. And now we actually have government agencies reaching out in advance, talking about how are we going to test for mpox? How are we going to test for bird flu? But I agree, the legislation is going to be really important, and we need to continue to work on this because we don't have a perfect system yet. But I think that there are two good case studies we could look at right now, at least that illustrate where we currently are, and that would be bird flu and mpox. And there's some
Yep.
updates too. You've probably been hearing about them in the news.
I have indeed. So, yep, and of course that's why people come to our podcast is to get our take on the news. So, I mean,
Yeah,
let's start with mpox because I think it is a very interesting it's an interesting one, and so and
yeah.
one to your point, where first of all, the CDC in particular is very interested in codifying and building out this kind of ability for the public health labs and the other labs in the country to work together. They actually, worked pretty diligently in the early days of the first outbreak of mpox post COVID, and so maybe that's a good place to start.
I agree. So maybe just a quick review. Mpox used to be known as monkeypox, but we're trying not to implicate the monkeys, who are actually not the primary reservoir host. Mpox has two clades, one and two, and to make it even more complicated, each clade has two subclades. So there's 1A and 1B and 2A and 2B. So it was 2B that caused the global outbreak in 2022. And then now cases have decreased, but that's when the Biden-Harris administration made sure that there was the Jynneos vaccine, the mpox vaccine for at-risk populations. But now, to make things worse, we are now seeing outbreaks of clade 1B. It was in the Democratic Republic of Congo, but it spread into neighboring countries. We've had imported cases in Sweden and Thailand. So the WHO declared a public health emergency of international concern. This is WHO's highest level of global alert. And you're right, the CDC has been proactive in reaching out to laboratories. They have an approved test that they are making available to certain laboratories that could be done. It's a rather manual, labor-intensive test, but it is a test that laboratories could bring in as an FDA-approved test. There are also companies that have commercial tests under the EUA, the Emergency Use Authorization. And talk about the public impact of what they're doing. The US is continuing to increase capacity for testing, and they're doing wastewater testing, looking in our wastewater for evidence of circulating either of the two clades, but specifically looking for clade 1B.
Yeah. Wow. Super AI. That you're bringing me back to wastewater testing,
I
another
know.
capability which we've known about for a long time, but really didn't kind of put into practice until COVID. And now it's good to see that, it is a way kind of like to have a bellwether for some of these diseases and know if they're kind of rising in our communities and if we need to focus testing. The interesting thing on mpox too is that one of the is really as you and I've talked about and that is around barriers to testing, right? And so one of the reasons why the CDC reached out to Mayo and other labs across the country was because of the challenges in getting patients to be tested because it was being transmitted through sexual activity, and there's just a stigma that's associated with that. And the public health labs really are not designed to. It's not that they can't do that, but it just they don't really design for that level of community outreach. And so that's where, again, you know, we as laboratorians integrated with medical practices are really thinking about ways that we can get patients access to testing, understanding where they might not want to be tested for a variety of reasons, but they should be tested so they can be appropriately treated and managed and prevent spread of disease. So that's another kind of important aspect to this is it's not just being able to do the test. And you also brought up FDA clearance, which is a whole nother
Mhm.
issue now with the FDA oversight
Right.
there, but and there is a carve out for that. But also the reason for this partnership is that we as laboratorians are thinking a lot about how to just make testing available in the settings where it's really needed. And
Mhm.
that's just not a core capability or function of a public health lab, right?
Right. And that does get into then industry, which we haven't talked about either, but they play an important role in bringing tests to the public or tests that are available for clinical laboratories to use, but potentially also for the public to use with at-home tests. Now, we don't currently have any at-home mpox tests, but that could be an additional tool in the future for expanding access, especially for something that's sensitive like a sexually transmitted disease.
That's right. And I think that's another interesting aspect to all of this is you brought up as well is that we ran into the same thing, of course, with COVID, is that most of the public health lab tests are not designed to be high volume and high throughput. They're much more around kind of detection and identification of pathogens that are coming or emerging. And so, how do we then partner with the manufacturers either to get faster access to high throughput tests that a lab like really any clinical lab, but especially a place like, our Department of Lab Medicine Pathology, which is dealing with high volumes both from our practice and then from the outside. And then how do we start to think about the use of at-home testing? Where I think we're really seeing this again, sexually transmitted infections is one that really is a logical place. It was again a place even pre-pandemic, but how do you kind of create this ecosystem that really serves patients and society for things like mpox? I think we now have syphilis as well, which is unfortunately another disease we've talked about, which is on the rise.
Mhm.
So there's a lot of to really, I think, again, the important thing is as laboratory professionals is that we need to be thinking about and engaging these conversations to help collectively through partnerships both with policymakers and government agencies as well as manufacturers to think about how we just kind of solve this riddle of having testing more available for these pathogens, which are going to continue um, to be something we have to deal with. And you mentioned the
Yeah.
other one, and that's bird flu. And I know there's another.
Hmm.
It's still kind of dribs and drabs of this, but now there's another, I think, case which has caused people to be at least gotten people's attention that was in Missouri, I think, right?
It was, yeah. You're right. We haven't gotten it quite right yet. We've improved back from 2009 and even before then, but we have some good mechanisms now. But we still need to work on this partnership of this private-public partnership. But this other example you talked about, Bill, and bird flu is a good example of how that does work together. So the CDC worrisomely just confirmed the first human case of H5 bird flu without known animal exposure, at least at this time. Now, that would be the 14th case in this year so far. And all the prior cases, the patients had known contact with either dairy cows or birds, mostly poultry. And of course, there's been many, many cases in dairy cows and in poultry, and of course, wild birds. But this one's concerning because there's no known source. So that could imply that there is human to human transmission, and the investigation is ongoing. But what I thought was really interesting about this case is that the patient was detected using your standard influenza A test, and it was positive, but it was negative for the seasonal, the typical circulating human strains of influenza virus, which triggered additional testing. And that's when it goes to the public health lab for confirmation. So that's a nice example of how your private labs, your clinical labs that are the front line, may detect a patient, and then the public health lab could do some specialized testing, which may not be widely available elsewhere.
Yeah. Yeah, no, that's right. And I think that, just for the people that are listening and maybe watching, since we are on YouTube, I think as well. But
Hmm.
it's like, why do we continue to talk about this? Because I think sometimes people are like, well, we got through COVID, and but it's really because we need to think about, the role of the labs, both public health labs as well as in the private labs, the labs that we work in, you and I, is to really, on the infectious disease front, is to actually maintain vigilance about what's coming in, right? And I think it's important for us to really understand what that looks like. Number one, because sure, there's not been nearly thankfully, the impact of these other illnesses yet that we saw with COVID in terms on the global scale. But if you're someone with mpox or potentially having mpox, you know, you would want to know it. It doesn't
Hmm.
matter if it's a global pandemic or not. If you're one of those people that has it, it's really important to you. So we need to think about the needs of patient and society. There's a big impact when you think about syphilis and congenital syphilis. There's an impact to all of us. So the reason that we need to continue to talk about these things and for the bird flu is because we need to maintain the awareness that there are these pathogens that are circulating in non-human hosts that if they cross over, and COVID was one of those, they have the
Hmm.
potential to really cause significant impact on society. So these are things that we need to continue to be engaged in. I think as you've talked about and others in Dr. Patel, other leaders at Mayo and across in the domains of infectious disease. Unfortunately, with global warming and climate change and other things, this is probably going to be something that another aspect of healthcare we're going to have to be more active in managing. So these conversations are just really important for us. We can't get fatigued because it's really a very important role of us in laboratory medicine is to maintain that vigilance both for our own, own society, but then also globally.
I agree. We have to maintain the vigilance, keep an eye on what is circulating, what might be emerging. Also, though, continue to advocate for legislation to give us the tools we need to be able to address these emerging threats, and also continue to advocate for good public relations with, well, with the general public, providing information, but also working with the government so that we can provide the tests that are needed. And maybe working with industry as well and trying to get a hold of tests early on so that we have the tools we need for detection.
Yep, that's right. And the last but not least, the thing I would say is just like on all of those things on the policy side, look, all of us in the US and across the world made major investments through our tax dollars in testing infrastructure and capabilities like wastewater, like genomic surveillance. We cannot let those things kind of collect dust because we still need them, right?
Right.
So the other thing is to say, look, we made the investments. We now really need to make sure that we continue to reap the benefit of those.
Well said. Well,
All
great
right.
talk as always, Belle. Thank you.
Yeah.
We'll put a little bookmark in for a next talk about Oropouche virus, talking about emerging pathogens. But I think we've covered a good amount for today.
Yeah. Yeah. Or yeah. I won't even repeat it because I might mispronounce it, but I look forward to it.
Thanks, Belle. Talk to you soon.
Sounds great.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.